So it went from a 5 to a 3 in 60 seconds just from putting this laser on there. This can be used for all sorts of soft tissue injuries, carpal tunnel syndrome, herniated discs, even neurological conditions like sciatica or occipital neuralgia, where you get those really bad migraines. And also another condition that we just treated before this is Bell's palsy, where you've facial paralysis. All right, folks, Dr. David Kulla here. We have Maria here, who does not speak, well, she speaks some English, but we also have her lovely translator here and daughter, right?
Yes.
It's a whole family affair. We see the whole family, but the Grams is having some major elbow issues, right? So she has what we call lateral epicondylitis or tennis elbow, and it's this elbow, correct?
Mm-hmm.
So we're going to show you how we test the elbow to make sure the elbow joint is in place, because you have a radial and an ulnar bone that connect in, and there's in a sense two joints in the elbow, if that makes any sense. And the joints rotate a little bit, right? The tibia and, excuse me, tibia, that's down here. The ulnar and radial bone rotate as you rotate your wrist. So we're going to go ahead and I'm going to have you turn and face me a little bit. And if you could translate for me, I'm going to touch some areas here on her elbow that are going to be very sensitive. And I want her to give me a number, 1 to 5. 5 being the most sensitive, 1 being the least sensitive. So if it's really sensitive, ow, you know, it makes her jump, that's a 5. Okay. So I'm going to touch some spots.
Okay.
This first area.
Es 5, ¿es sensitivo? ¿Te duele?
Me duele.
¿Es 5 o 4?
5. Ay,
Yeah, 5.
5?
Mm-hmm.
Okay, 5 there.
5 plus, no.
ay, ma.
Yeah.
5 there. Okay. 5 there.
Yeah.
Okay. And there?
Yeah.
5 also?
5 también.
So
No, como 4 aquí, pero aquí sí.
okay,
Okay,
5
4.
and 4 here.
Yeah.
Okay, so 5, 5, 5,
And 4.
and 4.
Yes.
We're gonna mark those with a pencil, folks, and then we're gonna test it right afterwards, after we laser it and see how she's doing. I want to show you guys there how amazing this cold laser therapy is. Right there,
Yeah.
5.
Yeah.
Just gonna put one mark on here, and ¿qué
5.
número? 5.
Como que... ¿Qué? 5, 4, 3, 4.
Ahí 5.
5.
Y ahí 4.
4. Okay, we're gonna do other points, but I just want to show you guys, you YouTubers, how amazing cold laser therapy is for soft tissue inflammation and damage.
Lahat.
Okay, so right now I have it on 1,000 hertz, so we're just focusing on inflammation and muscle spasms. And then after a couple of treatments, we go a little bit deeper with the laser therapy to penetrate deeper into the tissue, 3 to 5 centimeters deep. Right now we're doing a little bit more on the surface where there's more nerves, and this is just going to help her with her pain a little bit quicker, okay? This can be used for all sorts of soft tissue injuries, carpal tunnel syndrome, herniated discs, even neurological conditions like sciatica or occipital neuralgia, where you get those really bad migraines. And also another condition that we just treated before this is Bell's palsy, where you've facial paralysis.
Yeah.
And you can't smile on one side of the face, and the cheeks droop, and you can't even close your eyes, and it's very uncomfortable. And we had a patient that's had that for 6 months, and we're now into week 3, and she's already about 50% better. So it can be used for neurological conditions to calm the inflammation of the nerves down and inhibit the nerves.
Good.
Okay, now we're going to test that spot.
¿Qué número ahora?
Mejor. Número,
¿Qué
número
número? Hmm?
tres.
Trace. So it went from a 5 to a 3 in 60 seconds just from putting this laser on there. We're going to test the other spots here in just a minute. And we have rental lasers, so you can rent lasers by the day, by the week. You can also do that if you want, okay? It'll get quicker a lot faster if she's able to do 1 or 2 treatments a day for a couple days in a row.
I told her, she said she'd rather do it with you.
Okay, no problem. Some people would rather have me administer it. Other people choose to do it at home after I show them how to use it. This here is a 25 watt FDA 1A, class 1A FDA certified laser. These tend to be a lot safer for home use. When you start getting into class 4 lasers, they become a little bit dangerous for home use. You can overstimulate an area. With this one you can't because it's a super pulse laser. Very, very safe. And now we're going to test that area. Que numero?
Tres.
3. So pain level 5 is the highest, 1 is the least. It went from a 5 to a 3, both spots. You can imagine doing it again later tonight, again it's tomorrow. In a day or two, those painful spots will be gone. So really what this does is it speeds up the healing process. It excites the mitochondria to speed the healing process up, to pull nutrients into the cells, but also to pull inflammation out of the cells, making the cell wall more permeable. And this was the last spot that you named as a 5, a really sensitive spot. So we'll check that in just a few seconds here. And after this, we're going to muscle test her elbow and just make sure the joint is stable and not subluxed. Okay.
¿Qué number?
Ay, como un 1.
Wow.
Porque no siento mucho.
Gone?
1.
1.
Uno.
Okay, so from a 5 to a 1 in that spot.
Wow.
Impressive. Yeah, this
I know.
machine is nothing short of impressive. It's just incredible what this can do. That's why I've been using them for several years now. We're able to get results that we can't normally get without this stuff. Now I'm going to see her, if I can, in the middle of the week. That way we can laser her again and try to get this problem dealt with, resolved. Tennis elbow can be really persistent and nagging. So there might come a point where she needs to take one home and rent it, but hopefully we can avoid that, okay? And because this is a 25 watt laser, we have to leave it on each spot for about 1.5 minutes to 2 minutes, give or take. I have other lasers that are 50 watt. We don't have to put it on as long. The treatment times are quicker. The rental lasers are 15 watt. So those take about 2 to 3 minutes per spot, per treatment spot. Okay. What's that? Que numero?
No me siento nada.
0?
0.
0. So that went from a 4 to a 0, a 5 to a 1. That's a huge difference in 1 minute. Literally,
Yeah.
sorry, 90 seconds. I mean, that's a huge difference. And so now we're gonna go inside the elbow here, just hit a couple other spots, and then we'll muscle test your elbow. Okay. So she has some pain on the inside of the elbow too. The inside of the elbow is considered to be golfer's elbow or medial epicondylitis. The outside of the elbow, when you have pain out there, is called tennis elbow or lateral epicondylitis. All right. Do you feel anything?
Okay.
Do you
¿Siente
feel
algo?
anything right now?
Ahora, ¿siente algo?
No.
Yeah, you don't feel any pain with the laser. Yeah, you don't feel anything, folks. There's no warmth, no cold, there's just no feeling at all when it's
¿Siente
being
nada frío?
administered.
Nada.
There are no side effects to cold laser. The only side effect is if you're on medication that makes you sensitive to the sun.
Oh, okay.
Then, you could get a little bit of a sunburn, but that's it. No side effects. Want to keep it out of the eyes. Don't stare, into the laser light. And other than that, it's very safe. This particular laser has a magnet in it, so if you have a pacemaker, anything like that, you just don't want to use it too close to the heart, to the pacemaker. And we're going to hold it there on that spot. Yep. Typically 8 to 14 sessions of laser for tennis or golfer's elbow nips it in the bud. Sometimes people need to get adjusted, need the elbow or the wrist or the shoulder adjusted. We're going to adjust her now in a couple minutes. You got another minute here. Good. Hold it there for another 20 seconds.
Mhm.
And the last minute, you're going to hold it right there. Good. So if you guys have any questions about cold laser therapy, low-level laser therapy, it's also called photobiomodulation. There's a few names for it. Feel free to comment below, ask any questions if you want to see a video on a specific condition being treated by laser, so you can actually see the person being treated and then also see how they're doing. They're going to tell you if they've had a couple treatments, how they feel. These are not paid actors, okay? So,
No, an appointment.
yeah. So, again, if you have any questions or anything in particular that you want to see, comment below in this video. I hope you like the video, and I hope you guys subscribe because we're going to have more helpful videos coming out every week, 4 every week. Okay, I'm going to take this. Now I'm going to have you lay here on your stomach.
Apuéstate.
So she originally came to me with a lot of neck and upper back stiffness, pain, occasional headaches, right?
Yeah.
How have the headaches been? And how is her neck pain?
¿Ah?
Dolor de cabeza.
No, yo no estaba. Oh, no solamente que me sentía como algo aquí.
She
Pero
felt
se me
something there,
quitó.
but not the headaches she had before.
Much
Just a little, like,
Como
I don't know.
Okay.
aquí, como.
on the
Like a
left
little
forehead?
round.
Okay.
Right here.
But the headaches have been much less intense
Yeah,
and less in frequency as well?
less frequency,
There you
yes.
go. And I think we're on our third or fourth
Like fourth?
treatment. So if you have headaches, if you suffer from tension headaches, go see a chiropractor. Stop taking Advil. It doesn't fix the problem. that's called a PTLMS machine. We've got a few ways to loosen the soft tissue up. Huele aquí.
Un poquito.
Okay.
Dile si te duele.
Ahí.
There.
It's nice because this isn't really ART. ART is active release technique where she's actively moving her head side to side. I'm moving it for her. So I guess you could call this PRT. I just made that up. Passive release technique. So we're passively moving her neck side to side and opening up these trapezius muscles, the levator scapula, the supraspinatus, which is what's causing a lot of her tension and stiffness in her neck.
I like them.
And then last, we're going to check her elbow after we adjust her neck. Okay, take a deep breath in and blow all the way out. Relax here. Good. On your back. That was a big one.
Vamos, volteate.
Boca arriba, por favor. Okay, slide down a little bit.
Baja, baja.
Keep going. So I just adjusted
Sigue.
right here at the base of her neck and then the top of the neck. It's a hard area to adjust. But those nerves right there go to the heart, the lungs, and travel down the back of the arm into the tricep muscle and into the pinky finger and the finger next to it. So if you get numbness or tingling into the pinky finger, that would be why. So I adjusted that for her. We're gonna cross your arms here, tuck your chin down, take a deep breath in, come on up. Good, and blow out. Relax here.
Ay!
Hey, mamma mia. Yeah. All right, relax your arms. So, headaches, 50, 60, 70% better? What would you say, or less?
Ma, ¿cuánto tú crees que se te ha mejorado el dolor de cabeza?
No mucho. Oh, muchísimo.
More than 50%?
Yeah.
Okay, that's really good for 4 visits. So, she now knows what's causing her headaches. It's tension related, okay? Relax here.
Atención, mami.
Ajá.
Oh!
Okay, you're all set. And thank you guys for tuning in. I hope you like this video. I hope you subscribe to the channel. And let's give Maria a round of applause.
Thank you.
Good job. Good job. You're doing great. Okay?
Thank you.